Please welcome to the stage co-founder and vice chairman of EB Research Partnership, Jill Vedder. In her role as vice chairman, she oversees fundraising and serves as a senior advisor on strategic and programmatic direction. Please put your hands together for Jill.
It's certainly not every day in Seattle that it's this gorgeous outside, so I just wanted to start by thanking you all for spending some precious time with us. As you'll see, there's some truly great work happening, and I'm grateful to have this opportunity to share it with you. We are an innovative nonprofit dedicating to curing the life-threatening rare skin disease epidermolysis bullosa and curing it quickly. I first learned of EB when my childhood friend, his son, Mikey, was born with this devastating disease, and immediately my husband Ed and I knew that we could not turn away from these children and we had to help. Along with a dedicated group of EB parents, we started EBRP using a distinct and creative business model that's been very effective in speeding up the funding of treatments and finding a cure. We've made a ton of progress. When we first started, there were barely 2 clinical trials, and less than 10 years later, we now have more than 20. We still have a ways to go, as there are not yet any approved treatments. However, we are hopeful, and more importantly, our research community believes we will cure it. Additionally, the work we're doing in EB can be applied to the estimated 7,000 rare diseases that impact 10% of the global population. If we can cure EB, we can cure them all. It's now my pleasure to share with you the story of a young boy named Eli with EB and his sister Lily and how they are changing the world 2 letters at a time. We invite you to come say hi and join us in finding a cure.
Adversity, you know, that's where heroes come from, and they come in all shapes and sizes, obviously. And, you know, didn't set out to be one, but they are now.
My name is Eli Maya. I am 6 years old. I'm just a regular kid, but I have epidermolysis bullosa. You can call it EB. It's easier. EB is a rare condition. Sometimes it hurts.
Eli was adopted from China when he is 4 years old.
Rock, paper, scissors, shoot. Aha!
Our family knew he had EB, but that didn't make a difference. Eli is a superhero to me. It makes me sad when people stare or point at him, and sometimes they can say things that are really hurtful.
I tell people I was born different, but we are all born different, and that's great. We can all learn from each other.
We want people to know if someone looks different than you, instead of staring, they should come say hi. I hope that when people see our shirts, they'll take a minute to stop and learn more about Eli and EB. I think if we all come say hi, we can do a lot of good things together.
I want to teach you about EB.
EB?
Thank you.
Thank you very much. You guys have a wonderful day.
You too.
The more we understand each other, the better the world will be. Some people say my skin is like the wings of the butterfly because it can break easily. Butterfly wings are fragile, but they also help them fly. I may have EB, but I'm going to keep on flying.
Eli is amazing. For him to have this idea and let people know that it's okay when you see someone different. It's a huge thing, and it's very courageous. When you see the intense pain that these kids go through, the baths and the bandages, and it's about as hard a thing to watch as anything I've ever witnessed in my life. This is a big mountain that they have to climb every day, and it's hard not to want to dedicate a large portion of your life to doing whatever you can to help. A simple, small word like that, 2 letters, it can smash down barriers. So me and Eli want you to come say hi. Join us at ebresearch.org. Please, thank you.
Please welcome to the stage EB Research Partnership Chief Executive Officer, Michael Hund.
Good afternoon, AWS Imagine. First of all, I just wanted to give a very big thank you to our co-founder, Jill Vedder. Without her vision, we would not be here today. So thank you very much, Jill. It is an absolute honor to be in a room with change makers who want to be a catalyst for making the world a better place. People who want to turn inspiration into impact. Turn big ideas into bold action. Now, we all know that the world does not change on its own. It takes people who are going to fight for it, people who are going to make it happen. And all of us gathered here at this conference are the people that are going to make it happen. Now, I'm going to need your help in making something happen. I made a promise to Eli and Lily that as we share our mission across the world, going from place to place, that we would make a difference and celebrate differences 2 letters at a time, that I would gather as many highs as possible. So, there's a lot of people in this room, and you're all very capable. What I'm going to ask you to do is on the count of 3, say hi, Eli and Lily, as loud as you possibly can so they can hear us on those boats out there. Sound okay? And I'm going to film it so I can send it to Eli and Lily, and they can know that each and every one of you are with them in spreading this message. You think you guys can do it? Yeah. Oh, come on, you can be louder than that. Can you do it? Yeah. I like it. Okay, so it's hi, Eli and Lily, on 3. Let me get my camera ready. Okay, 1, 2, 3. Amazing, beautiful, and thank you. They're going to absolutely love that. And I'll get all the photo releases before I put it on Twitter. So for Eli and the 500,000 people in the world with epidermolysis bullosa, EB for short, time is a valuable asset. For those with the most severe forms, life expectancy can range from a few months to 30 years old. It's a genetic rare disease that from the moment of birth causes the largest organ in the body, the skin, to simply not work. Gentle scrapes become wounds that never heal. EB is not only external, it attacks the internal organs as well. Every day is full of pain. Now, most parents have never even heard of EB until their child is born with sheets of skin missing. They wake up every morning not knowing what to expect from the night before and the new wounds that will greet them. They spend hours taking bleach baths and carefully applying full-body bandages. They travel to a host of doctor's appointments, dermatologists, pediatrician, oncologist, physical therapy, occupational therapy. They need constant surgeries to be able to open their hands, to be able to walk, to open their eyes, and even to stop the throat from constricting so tight that breathing or eating becomes impossible. Then, they go to bed and they do it all over again the next day. Because today there's no FDA-approved treatment for EB, which means that parents that have children with EB, the best options that they have available to us are the same bandages and lotions that each of us go and get at our local grocery store. Now, as you heard Eli say, children with EB are called butterfly children. Because for them, their skin becomes like the wings of a butterfly, because it can break like that. And while butterfly wings are fragile, they can also help them fly. And while Eli may have EB, he will keep on flying. Together, we will fly. And at EB Research Partnership, we don't want to just fly, we want to soar. We want to inject rocket fuel into advancing life-saving treatments and cures for EB. And we are willing to fight for it. EB Research Partnership was born in 2010 to solve this problem by a group of parents who were simply setting out to save their children's life. And along the way, they picked up a group of rock stars and business leaders to pioneer a path to a cure, to build a new model, to inject speed in the system. One bold, audacious goal: cure EB and cure it quickly. And we can see it. Now, great leaders have come before us with visions of far-off destinations that they've spent their entire career pursuing. It was John F. Kennedy in 1962 saying, "We choose to go to the moon not because it's easy, but because it's hard. Because it'll measure the best of our collective energies and skills. Because it's in a challenge that we intend to win." And then they made it happen just 7 years later. Some call this outcome-based thinking. At EB Research Partnership, we call this outcome-based believing. Why? You see, many diseases have hundreds or even thousands of complications and mutations that running amok in our 25,000 genes. Researchers spend an entirety trying to decode an infinite array of possibilities. Finding targets to attack remains elusive and exhausting, a seemingly endless pursuit. But guess what? For us in the EB community, there's good news. We have pinpointed the mutation that causes EB down to one gene, the gene that makes collagen and allows our skin to heal. We have discovered our target. We have it in our sights. We have EB cornered. It's not science fiction, it's scientific certainty. Now, our focus is to accelerate research from a bench in a lab to the bedside of a patient at the speed of sound. Curing EB is not an if, it's only a when. Now that is a destination worth arriving at. Not because it's easy, but because it's hard. And we will drive forward with endless urgency on behalf of patients and families that battle this disease every single day. Because we intend to win. Outcome-based believing. Now, change doesn't happen on its own. It takes people who are going to fight. People will make it happen. We have a plan, and we're taking the lead. We call it our blueprint for a cure. And it involves taking bold innovation, multiplying it by strategic collaboration to get a result of exponential acceleration. So how are we going to do it? Bold innovation. New ideas are great. Thinking differently is important. However, what we're calling for here is innovation that pushes on the foundational constraints previously thought to be immovable. Not just shaking them, but imploding them to build anew. Not just stepping outside of our comfort zone, but taking leaps. For us, our bold innovation, we want to lead the way to build a new model for medical research, to put speed in the process of getting meaningful treatments from under a microscope into the hands of patients. A way to align the incentives of the research, industry, and patient communities. The key for us is venture philanthropy. That means that we don't just hope checks and we don't just write checks and hope for the best. We invest in projects that can result in a meaningful therapy in the next 3 to 5 years. And if that therapy succeeds, we share in its success. We're like venture capitalists with a cause. Here's how it works. So just like any other nonprofit, we raise donations and funds from the philanthropic community. We source the best and most brilliant ideas from a global research community. Those ideas are then evaluated by our scientific advisory board, who makes recommendations to us on the best science to fund that holds the most promise to getting to treatments and cures quickly. We then evaluate those, and that's when our role as a traditional nonprofit changes, because why should we just make a donation or make a grant and make funding without expecting to participate in the same way that a company or a VC would? So we negotiate deal terms. Whether it's a university or a small biotech or a publicly traded company, we come to the table and negotiate on behalf of the patients. That's our stakeholder. So that when that project is commercialized, we share in the equity, we share in the returns, and we pump it right back into our nonprofit foundation to continue to fund EB research until we find a cure. So what does this accomplish? What are the results of thinking differently and trying this new model? Well, let me give you an example. 3 years ago, we found a university that had a really innovative gene therapy project. And it was vetted by our scientific advisory board. We decided to fund it for $500,000. Just 2 short years later, We helped accelerate that into clinical trials, and there was interest from a publicly traded biotech company. When that biotech company acquired the IP from the university that we'd funded, we exchanged our equity that we had in that company for a financial return, again, to go right back into research. So as a result, we took $500,000, turned it into $3 million, and pumped that right back into EB research. So not only is this innovative and a way to think about things differently, this is sustainable. It's a new revenue source that we can fund research and critical research for. Strategic collaboration. Uniting and incentivizing the often disparate, fragmented, and siloed academic medical centers to work hand in hand together, bringing together the best, breaking down silos to build bridges. We see collaboration as a catalyst for a cure. Let me show you how we put these ideas into action. So we had 3 top universities come to us with a really, really innovative new idea on a project for EB that held the potential for a cure. Now, they all applied separately, separate research applications. And there was so much synergy to be found. They were approaching the same target with the same approach, yet each university had a different expertise. One was an expert in gene editing. The other was an expert in manufacturing, and the other was an expert in actually doing 3D printing of skin. So we went back to those 3 universities and we said, look, we really want to fund this important research. However, we have a condition. We'll fund this important research if the 3 universities come together and collaborate. That's our condition. And the universities said, absolutely, we agree. So in 2016, the IPS Cell Consortium was born. Now, what are they working on? When you bring those brilliant minds together, they have come up with an idea for the first of its kind platform technology. Let me tell you how it works. So they take a small skin sample from a patient with EB. They then isolate what we call IPS cells. Those are our blueprint cells that give directives to almost every function in the human body. They can then look at those IPS cells and find the exact mutation that causes EB. And they can fix it. It's like cut and paste. They can correct it with CRISPR-Cas9 gene editing. Then they can take that cell that inherently has everything the same about that individual human, precision medicine, precise medicine, except the one thing that's been fixed is that mutation that causes EB. Then they proliferate new sheets of skin, and they give it back to the patient. Now, this approach holds the potential to be a definitive and curative treatment for EB. And even better yet, this is a platform technology where EB is a case study. We're first off the runway that can be applied to any genetic disease. So what are the results of these groups coming together? We just talked to the lead of this project last month, and he shared with us that in isolation, if I was just working with my one university, this would have taken more than 15 years for this idea, as groundbreaking as it is, it would have taken 15 years to get into a clinical trial into the hands of a patient. Because you brought us together, because we're working together in unison as 3 universities in a consortium, we've cut the process down to 5 years. That is 10 years faster. That's a decade saved. And for patients, that translates into life saved. All because of the power of strategic collaboration. Now, there's even more. If it can move this fast with 3 universities, how fast can it move with 21 universities, 21 centers of excellence, all working together in EB? So we formed the EB Clinical Research Consortium. Working in union, they have built the largest data set in EB with more than 800 patients. And they're conducting collaborative research to improve and advance care and increase speed through realized synergy. Bold innovation, strategic collaboration. We get exponential acceleration. Now, what does that mean in data? What does that mean in real numbers? Since we started less than 10 years ago, we've raised $25 million. We funded 50 projects across the globe. Now, from when we started, there are 10 times the amount of clinical trials, from 2 to 20. That's unprecedented, not just in a rare disease, but that's unprecedented. Even better yet, while there's still no approved treatment for EB, We expect 5 phase 3 clinical trials in the next year, the last and final phase before we might have our first treatment approval for EB. What does exponential acceleration look like? There will be more clinical trials for EB in the next 3 years than the last 10 years combined. While we've made tremendous progress, we're not there yet. While we can see the finish line, now is not a time to turn back. Now is a critical moment in time. We need to double down into the ultimate acceleration, leveraging a technological revolution to make our vision of cures a reality. Now, in 1990, the NIH embarked on the Human Genome Project. When they started, the cost of that project was $3 billion. By 2001, the cost to sequence the DNA of one human was $100 million. Today, it's less than 1,000. The rate of technological speed and capacity is far outpacing Moore's law of a doubling over every 2 years. Additionally, we're in an era of rapid evolution through cloud computing, providing us the storage, software, and security to leverage analytical intelligence to achieve speed and economies of scale. We simply could not do this at scale and put this speed in research without cloud computing 10 or 15 years ago. So how do we bring these technologies together to achieve the ultimate outcome of a cure? Enter AWS, built on a culture of innovation and big ideas. The AWS team asked us to gather the stakeholders, the key players, and what do you get? What happens when you put researchers, clinicians, industry, and patients in one room at one table? I know it sounds like the beginning of a bad joke, but it was the beginning of transformation, the beginning of an end for EB. We convened on a summer day at the University of Colorado, and we began Amazon's working backwards innovation process, focusing on the customer first, which for us was patients and families fighting this disease and the researchers dedicating their careers to working on curing it. They would not let us leave until everybody agreed on a one-sentence problem. We discussed, we debated, and we decided. What if we could make navigating the research and patient journey as easy as entering the destination into your GPS? A groundbreaking technology platform where research, industry, and patient communities, today islands in an ocean of a hard-to-navigate healthcare system, could come together to access, analyze, accelerate. Where data was once divided, it can now be united. Where our maps were built from patient genomic and clinical information, from research data. Where our left and right turns were the right treatment for the right patient at the right time. And our destination is a cure for EB. Now, I got to give a shout out because immediately the most brilliant, amazing team of engineers called Envision Engineering got to work. And I want to take this moment to thank Ryan, Eddie, Eric, Hatim, Tracy. You know, oftentimes these engineers are behind the scenes, but these are brilliant, brilliant engineers. I mean, imagine the power. And I felt for them because I'd go to them with crazy ideas. What if we can do this? What if we can do that? And they say, yeah, we can do that. We can build that. It was remarkable. So together, here's the future that we're building together. We want to take large-scale patient data sets. For us, our 800-patient CCOD that's a collaborative between 21 universities, it's fragmented. It's not on a great technology platform. We want to combine that with biorepository information and genetic and phenotype sequencing. All this exists in silos at different universities. We want to corral that data and put it in one technology platform. Natural history studies. For rare diseases, natural history studies are crucially important, yet very hard to find. They're data on the natural course of the disease without any intervention. It's our baseline. How does the disease exist today, and what can we understand about it? What can we build on? How can we improve? How can we make it better? And then directly to patient. You know, we talked about this a little bit earlier on our healthcare roundtable, but one of the problems we have is that, you know, the healthcare system has bad UX. It has bad customer experience. It has bad user experience. Anybody who's ever been a patient or has a family member that's been a patient and try to log on to clinicaltrials.gov and navigate it knows how difficult it can be. It should be simple as finding the best restaurant within a 5-mile radius to find the best clinical trial. So we go directly to patients and ask them the questions that are important to them. Let them provide their healthcare data. Let them provide their genomic sequencing and samples. We then take all those inputs and we put it on a state-of-the-art platform built by AWS, providing security and HIPAA compliance and a network of partners and tools and machine learning and artificial intelligence and rapid analytics and all the things they can do with these massive data sets to make sense of it. It's Albert Einstein saying that genius is taking the complex and turning it into the simple. So what are the outputs? We take that data and we give it right back to the research community that contributed it. So our 21-member EB Clinical Research Consortium, if you're giving data, if you're coming to the table and you're signed up to joining us in curing this disease, and you want to move fast with us, if you contribute data, you can get it right back in the form of 20 other centers. Industry, clinical trials. Today, for many rare diseases like EB, a phase 1 clinical trial could be 2 to 5 patients. Yet they're so incredibly hard to find. So incredibly hard to find. There's treatments and trials that exist, but they need to be connected with the patients. There's a barricade, there's a blockade right in the middle. So for patients that raise their hand and they say, here's my sequence, here's my subtype, I want to participate in a clinical trial. I just don't know how to find them. We can take these data sources and link them to industry in a way that could advance clinical trials. And finally, the holy grail, patients and families. You know, I know there's been many brilliant data initiatives, probably many done by folks in this room, but for some reason we forget about the patient. The patient is at the center of everything. The patient should be able to participate in the data. The patient should be able to learn from the data. The patient is the one contributing the data. So we imagine a world where a patient can log on to this first-of-its-kind platform. And rather than a doctor at diagnosis telling the parent, don't search the internet for this because it'll scare you, and there's so much uncertainty, we want to change that to no. We know exactly where you can go to get the information you need. We imagine a world where a patient can see, upon the moment of diagnosis, show me the best EB doctor within 100 miles, immediately linked. That a patient and their family can see at the moment of diagnosis, what are other patients with my genetic subtype, other patients like me, what are they doing? What treatments are they taking? And which treatments have the best outcomes for me and my unique type of EB and my unique subset of EB? We envision a world where a patient who raises their hand and volunteers to participate in research on a clinical trial can be automatically connected via sophisticated technology to the right clinical trial for them. We envision a world where a patient goes from a world of uncertainty to a world of answers. Now, here's our plan. We're building this model as we speak, and we're going to pilot it at the University of Colorado. Prove the concept, IRB boards, make sure that everything is done in exactly the best way. Once we prove the concept at the University of Colorado, we're going to immediately scale it to our 21-member consortium. And once we prove that, and once we prove this can work and the benefit to researchers and patients, there's a bigger problem to solve. You see, EB is one of 7,000 rare diseases that impact 10% of the global population. That's 350 million people. That's more than HIV and cancer combined. 1 in 2 are diagnosed with a rare disease are a child. 3 of 10 won't even make it to their 5th birthday. And 1 in 2 don't even have a foundation or an advocacy group to fight on their behalf. 10% of the global population, yet 95% have 0 approved treatments. This is a problem we're solving. this is a destination worth arriving at, a world where we can leverage technology to see that number go down and down and down. And if we can do this, what does our future look like? For Eli and the hundreds of thousands just like him, it means he can play, he can walk, he can run, and he can ride a bike just like other kids. It means that the daily bleach baths and hours of bandaging are no more. It means that a schedule once full of doctor's visits can be filled with vacations and new adventures. It means no more fear, it means no more pain, it means a cure. It's our hope that you will never have to pronounce the words epidermolysis bullosa again. It's our hope that we can put an end to EB. So we thank each of you for the good work that you do. And it's our hope that you'll find inspiration to solve the problems in your communities. And along with the help of AWS, embrace the art of the possible. Thank you very much.
Thank you, Jill and Michael. Let's give all our speakers today another round of applause. What an incredible and inspiring day this has been. We're excited to see you back here tomorrow morning for day 2. Doors open at 8 a.m. But the fun doesn't stop yet. We now invite you to continue the conversation out at our welcome party, kicking off right now.